Hi there, my name is Nick McCormick. I thought the best way for me to introduce myself would be through a brief video here, so bear with me as I kind of go through the few slides here and kind of talk about what I can do for you and what I can offer. So I have actually been working in healthcare myself for about 11 years, and in that time I have done some work with social media within the healthcare realm. Um, I want to suggest two basic things for this project, which would be social media marketing and messenger marketing. And I'll kind of go into detail about what messenger marketing is. Um, Social media marketing, as you probably well know, it just revolves around a lot of content. At least that's the way I view it. The more value you create, the more content you can create for your public, the better. So as you mentioned in your job posting, it's both the B2B and B2C consumers that you're aiming for. So I think both of those have different strategies that we could go about deploying. Um, the other component to this is if it is a B2B customer, they probably are looking for content that addresses some of the quality measures, such as diabetes, hypertension, BMI, a lot of things that they're either looking for to strengthen as part of their overall strategy as it relates to some of these quality measures that things like the Medicaid, Medicare look for, um, and that kind of thing. And also, one of the things I always suggest to any client is when we do start talking about that content creation in those posts, to limit those to 1 to 2 posts per day per different channel. So studies have shown that if you do more than that, the client, the end user, starts to disengage. So my thoughts were around something like diabetes content, like creating series. So a series that goes around nutrition, diabetes, such as like carb counting, foot care and diabetes, proper blood sugar monitoring, that kind of stuff, where you can kind of take one of those components and really stretch it out into various posts, various little bits that we can kind of drip out bit by bit. And I know you mentioned blog postings, so maybe like 4 blog postings a month. So those same kind of topics we were discussing here that we kind of drip out bit by bit, we can kind of create a more in-depth and robust blog post about. And to that point, I created a small little blog post here that just talks about some helpful tips for diabetes patients. So 3 carbs that you didn't know were hiding in everyday foods. So that's kind of part of the idea I had, was taking that broader idea of diabetes and kind of taking into very different paths that we could create content around. And then what that might look like in a Facebook posting would be something like that. And then my other strategy I thought of when I was reading your job posting was Facebook Messenger marketing. So Messenger marketing is a pretty new realm for marketing. Basically, what it is that you set up a chatbot within your Facebook page, and when visitors come, the chatbot will automatically engage with them. And the first thing it does is ask for permission to reach out to them in the future. The user can then opt to say yes or no, or not, ask me later or something like that. So then if they do say yes, what we have in essence there is the same thing you would have as with an email marketing capture campaign. So like if you used like Facebook ads to send to a squeeze page to then get a email address, this is kind of the same effect. Um, the only difference is that it's pretty huge. So basically, it's 1.2 billion users per month on Facebook Messenger, and chatbots have an 88% open rate and a 56% click-through rate. And if you've ever done any email marketing in the past, you know that those are pretty outstanding numbers. So the way it would work is basically I could install the chatbot on your Facebook page, and it would pretty much that it would take care of everything we need to do all the heavy lifting for us. Um, we would have to train it bit by bit. So you can set it up with a pretty rudimentary interaction. So it would just answer a few questions here and there. But then as time went by, you could kind of train the bot to kind of get a little bit more robust and answer a few more questions. Um, always, there's always the default to if the bot can't answer, it'll default to a human being. And then once we start gathering these permissions to reach out to people, to visitors, then we can start planning other campaigns. The same as you would with an email marketing campaign, obviously a lot briefer because this is on someone's messenger it's popping up on, so it'd be a lot briefer than an actual email marketing campaign. But so far, the results I've had have been pretty outstanding with the messenger marketing. And then I thought I'd answer some of the questions you had posted on the job listing. Yes, I've worked with social media for a healthcare organization. I was actually in charge of a Spanish Facebook page for an HMO, and I did that for some time. And as I said, I've also been in healthcare for a while. I've actually worked as a clinic manager for some time. I unfortunately do not have any experience with Sprout Social, although I know I'm familiar with it and I know what it is, and it's very cool. So while I don't have the experience of that in the past, it looks really straightforward. I'd be happy to dive into that. Um, do you have any suggestions to make this project run successfully? I think the main thing is just knowing our audiences. So if it's more B2C, then it's directing that content towards them. And how can that help their daily lives? How can we help improve their diabetes? How can we improve their hypertension? Tips to quit smoking, things like that. If it's more towards the B2B, then we got to think of things that are more related to the quality metrics that you're trying to measure, or sorry, to improve. How we can improve these campaigns to kind of raise awareness about their own brand. So the message would vary there a little bit, but I think if we can kind of hone in and get those messages correctly, then I think it'd be a great success. I'm a particularly good fit for this because I know the healthcare industry. I know it very well. I know it from an administrative point of view. I've been in it for a while, and I've also worked in social media in it for some time as well. So I feel like I'm pretty well equipped to have the necessary skills to kind of let this take off. So anyway, again, my name is Nick McCormick. I'd be more than happy to talk to you at any point if that's something that's of interest. Yeah, so just let me know. Thanks so much.